You guys have been screaming at me about scalp care, so let's have it with the Scalp Care series. Y'all ready? The beginning of appropriate scalp care begins with being able to identify and understand what kind of scalp you have. So in this video, we're going to be getting into the most common types of scalps that I see as a trichologist and also helping you figure out where you may fall on this scale. Now, this video is going to underpin all subsequent videos I do on scalp care, so you really don't want to miss this. All right, enough chit chat. Let's get into this video. Now, I always like to contextualize the scalp in the context of the skin at large, mainly because that's exactly what it is. There are, however, two main distinctions between the two, and those are the fact that A, the scalp is typically the most densely packed area of hair on the body with terminal hairs, and B, the fact that the scalp has larger and more sebaceous glands than most other parts of the body, comparable only to the face, and if we're going to include the men, the back and the chest as well. Now, given that sebum production happens in the sebaceous glands, this simply means that the amount of sebum that your scalp produces plays a major role in the state and health of your scalp and the hair that grows out of it. So similar to how it is with skin types, when I refer to scalp type in this video, I'm doing so from the perspective of how much sebum your scalp produces, or simply put, whether your scalp is oily, dry, or normal. Having an understanding of where your scalp falls on the scale can be helpful for a number of reasons. One, how much sebum your scalp produces is typically linked to other balances or imbalances in your body. So when better understood, not only can this help give further clarity to existing health conditions, but it can also be a push to further investigate an undiagnosed condition that you may have. Two, it will better help you determine the kind of products that you should be using or not using for optimal scalp health. And three, it will also inform you on how best to avoid certain scalp conditions that you may be more prone to because of your scalp type. Now, before I go any further in this video, I would like to say that the full roster of scalp conditions is much more vast and varied than whether your scalp is dry or oily. But it should also be noted that your scalp type, as it pertains to sebum production, can be influenced by other conditions. And like I just alluded to in my last point, that itself can also influence your predisposition to experiencing other certain scalp conditions. So with that said, how about we jump right into the first end of the scale with oily scalps. As the name implies, if you have an oily scalp, this simply means that you experience excessive sebum production. In such cases, the onset of this oiliness can typically be traced back to puberty, and this is because the increase in androgen production during and after this time period causes an increase in the size of the sebaceous glands and thus also increases the amount of sebum production. To give a bit more context, androgens are hormones that the body secretes for us to be able to grow and reproduce. Now, testosterone would probably be the most widely recognizable androgen, but despite typically being considered as male hormones, androgens are present and play an important role in both males and females, especially when it comes to the changes that need to occur during puberty. Like, for example, the development of secondary sexual characteristics like armpit or pubic hair. The only difference is that females typically have reduced androgen secretion than males do. So, for example, this is why, whilst both male and female voices tend to get deeper after or during puberty, males will still ultimately develop deeper voices than females will, simply because there is typically just less testosterone secretion in females. In a similar way, sebum production is equally linked to androgen secretion. This explains why excessive production of sebum on the scalp, face, chest, and back tends to begin during puberty when androgen secretions begin. And this also explains why after puberty, males experience greater sebum production than females do. Now, anyone can experience excessive oiliness of the scalp, but all things being equal, males are a bit more likely to experience this than females are. So that being said, here are some other things to consider that may help you figure out whether you fit into this category. Excessive oiliness is typically not limited to the scalp alone. If you have an oily scalp, this oiliness will likely also be experienced on the face, especially around the forehead, the nose, and the chin. Another thing to consider is that people with oily scalps tend to notice that the scalp and hair get oily, particularly around the frontal hairline. In addition to this, the oiliness typically causes the scalp to feel itchy. People with oily scalps also tend to report that their scalps feel normal after shampooing, but then becomes oily and or itchy again within about 8 to 24 hours after shampooing. Okay, ladies, listen up, because this next part's really important for you. One important thing to note here is that, particularly for females, certain conditions have either been known to increase sebum production or have been somehow linked to an increase in sebum production. The vast majority of conditions that have been associated with an increase in sebum production are conditions that occur as a result of thyroid imbalances. So it's really not uncommon for people who have conditions like like hirsutism, PCOS, hypothyroidism, or even chronic adult acne to also have an oily scalp. Now, when it comes to associated scalp conditions, these include seborrheic dermatitis, dandruff, and also androgenetic alopecia. Now, these conditions are simply typically seen together, but it should be noted that that doesn't necessarily mean that they have a causal relationship. If you find that you're resonating with a lot of the things that I've just mentioned in this past section, then it's more likely than not that you may have an oily scalp. But just to make it that much easier to figure out, there's a simple, easy blotting paper test that I did in this video that you can go ahead and try to see just how oily your scalp really is. Now, bear in mind that when I did this test, my hair was about 3 weeks post-wash, and I would consider myself to have a somewhat normal scalp. So if you're getting the same results after about a week or a few days, then it's likely that you have an oily scalp. Okay, you gotta level with me here, guys. If you're finding this video insightful so far, then please go ahead and hit that like button for me so more people can see this video. Also, if you haven't already, please go ahead and hit that subscribe button and the notification bell so that you don't miss out on any of my future science-backed hair care videos. Right, let's get back to business with the lowdown on dry scalps. Okay, so if an oily scalp is what you get when you have excess sebum production, then naturally a dry scalp would be what you get when there is insufficient sebum production, right? Well, kinda. That first part is true, but it's only half of the story. In reality, it's more than just a lack of sebum production. Dry scalps have also been linked to impaired barrier function of the stratum corneum, which is the outermost layer of the skin. Now, in order to explain what this means exactly and how it translates to having a dry scalp, let's take a closer look into what the stratum corneum actually is and how it functions to keep the skin and scalp protected as well as moisturized. As the outermost layer of the skin, the stratum corneum is considered the skin's principal barrier. Its main functions include A, preventing water loss, and B, protecting the lower layers of the skin from things like antigens, toxic agents, as well as UV light. Now, the stratum corneum is largely made up of two structural components that Dr. Peter Elias so very helpfully illustrated with a brick and mortar analogy. In this analogy, you have the corneocytes, which are the bricks, and then you have the intercorneocyte lipids, which are the mortar. Now, a corneocyte is a protein complex that is made up of tiny threads of keratin that can hold large amounts of water between its threads. When it comes to the intercorneocyte lipids, 50% of this mortar, as it were, is made up of ceramides, 25% of it is made up of cholesterol, and the rest of it is made up of sterols, essential and non-essential free fatty acids. So these rivet-like structures you see here are called corneodesmosomes, and they also play an important role in the structure of the stratum corneum, but they're not exactly relevant in this context, so we're just going to go ahead and ignore them today. Now, the ceramides, however, they're the real stars of the show today. Ceramides are what are primarily responsible for both the barrier-forming and the moisture-binding functions of the stratum corneum, to the point that research has found that patients with dry scalps and dry skin have low or lower ceramide levels in their stratum corneum than people who have normal or oily skin. And to further prove that dry scalps are a matter of poor barrier function, studies have also shown that the barrier quality of the stratum corneum in normal skin is 40 times higher than that of dry skin. So like we did in the previous section, here are some telltale signs that may be able to help you figure out whether you fit into this category. Do you have a scalp that tends to feel tight, especially immediately after shampooing or in colder winter months? Another possible clinical feature here is having cracks in the skin on your scalp, whether those be cracks that are visible or cracks that you can feel. Chronic itching is also another common clinical feature of dry scalps. Interestingly enough, this is also linked to another telltale sign of having a dry scalp, which is roughness on the scalp skin. Now, this roughness is called lichenification, and it's basically just a thickening of skin that occurs as a result of excessive scratching of the skin. Flaking. Flaking is another common symptom of dry skin. Now, because flaking is also associated with oily scalps, just keep in mind that flakes from dry scalps will typically be whiter or grayer in color than flakes from oily scalps, which tend to be yellower and more waxy to the touch. Finally, it's worth noting that because the skin is all connected, if you struggle with other skin conditions like eczema or atopic dermatitis, for example, that you may be more likely or more prone to having a dry scalp. And now, a brief note from our sponsors. Wait, guys, I'm kidding. There are no sponsors. What I actually was going to say was a brief note on normal scalps. How do you know if you have a normal scalp? Well, I mean, if you didn't identify with anything from the other categories that I just mentioned, then You feel me? Real talk. The best way to know if you have a normal scalp is if you've never noticed or had to notice your scalp for any reason. People with normal scalps generally tend to be able to get away with doing the most and still face very little consequences. If you're able to go weeks without washing your scalp and not have to deal with excessive itching, inflammation, or flakiness, then it's likely you have a normal scalp. Similarly, if your scalp typically feels fine immediately after washing or clarifying and it doesn't feel tight, then this furthers your case for having a normal scalp. Finally, if you've been able to get away with using a wide range of skin, hair, and body products with no need for specialty creams or cleansers specifically designed to target a skin condition, then yeah, you probably have a normal scalp. Now, before you drag me in my own comments, I would like to acknowledge that there is one more type of common scalp type that I have intentionally left out of this video, and that is a sensitive scalp. Now let me reassure you that I do have a whole separate video lined up to address this, and I just felt this was the best approach given that this video primarily focuses on scalp type from the perspective of sebum production. When it comes to the scope of sensitive scalps, however, it is typically quite varied and sits across the different scalp types according to sebum production. That is to say, whether your scalp produces too much, too little, or just the right amount of sebum, your rate and or amount of sebum production doesn't automatically make you more or less susceptible to having a sensitive scalp in one way, shape, or form. Should it also be the case that you do have a sensitive scalp, however, understanding your scalp type from a sebum production point of view will only further assist you in building the right kind of scalp care routine for you. Okay, well that's all for this video today, guys. In the next video in this series, I'm going to be talking about the products that you can use to moisturize, regulate, and or balance your scalp based on your scalp type, so stay tuned for that video. As always, thank you so much for watching, and I look forward to seeing you in my next video. Bye!
I finally stopped running now. With you I found my peace somehow. Let go of every thought that was holding me back. Yeah, I'm in love with you in every way. The joy you give me every day makes me forget